Namaskar and welcome to the Centurion University podcast series. Today we are into an exciting conversation with the most important, crucial, but less explored healthcare programs. Anesthesia and Operation Theatre. These professionals are backbone of successful surgery, ensuring patient safety, smooth procedures, and efficient OT procedures. To help us understand this field better, we have with us Miss Anna, ma'am, Assistant Professor from Department of Allied Sciences. Thank you for joining us, ma'am.
Thank you, Naina. And it's my pleasure to take a part of this program, which tells me about which plays a key role in modern learning.
Thank you, ma'am, for joining us. Can you, many of us students are not aware of what it is, what OT or theaters functions. Can you help us knowing it more better?
Yes. So majority of the students, they generally prefer going for their MBBS or their masters, or they try to become medicos. So they soon after they join their BPC or whatever it is, and being a student of life sciences or being a student of science, they prefer to become a doctor, because being a doctor, it adds a professional feeling, right? So apart from becoming a doctor, you have many other options available right now. So one of such option that we have is that is developed by the Allied Healthcare Sciences is AT/OT technology, that is Anesthesia and Operation Theatre technology. So briefing about Anesthesia and Operation Theatre technology, it is a course wherein which a technician or a student who pursues this course will be able to assist the theatre, especially, and they play a key role in operation theatre to the anesthetologist or whatever the surgery is going on. And the work overall done by the anesthetist is look after, or these are the students, or these are trained exclusively wherein which they become the backbone for the OT and coming to the wards or trauma centers, whatever it is. So this is the key thing that plays an important role wherein which a student is trained in operation theatre technology.
Okay, ma'am. Can you tell me what exactly is anesthesia and OT technology? And why is that important in healthcare?
Because their work directly, it reflects on the procession, or it directly reflects on the procedure of the surgery that is going to be done. See, for example, there needs to be a surgery done. You need to have an anesthetist. That can be even a smaller surgery or a bigger surgery, right? And if not everybody can become an anesthetist. Yes. For an anesthetist, you need somebody to help them. So these are the healthcare professions where they are skilled and where they are trained in such a way that they help the anesthetist in doing on the procedures. And exclusively, the key things or the skill that our students learn is they have an exclusive hands-on training. Yeah. So that gives them, or that builds them, because we also have these simulation labs. We also have advanced equipments, and the students are also sent for their clinical practices and healthcare practices, wherein which they directly interact or they directly have a hands-on session. They have a direct hands-on with the patient itself. So the more they go on, the more experience they learn. So it gives them an additional knowledge. It gives them an additional input during their academic career itself before they become a true OT technician or true anesthetist.
Yes, ma'am, rightly said. What knowledge and skills do students gain in this technology?
As I have already stated, we have designed a program, or we have designed the curriculum in such a way that they have an exclusive simulation-based lab trainings, and we also use advanced learning methods and practical-oriented sessions, so that during their learning or during their academic year of 3 years or 4 years, they will be exclusively learning about the basic human anatomy, physiology, pharmacology, and medicines, etc. Wherein which that puts the keystone, or that gives them the brief understanding about the human being. What exactly is the anatomy of the body? What exactly is the physiology? Because once you learn the basic things about anatomy and physiology of all the organs that are present, it gives them a clear-cut idea as to what they have to go on. So it is prepared in such a way that in the initial period till they end their academic year or whatever the duration of the course is, it is a training, or it is a progression of their knowledge step by step, which is assessed in different levels, and it is assessed and monitored by exclusive anesthetists as well as well-trained faculty.
Can you tell me how does only Centurion University gives a hands-on learning for this program?
To be in brief, Centurion University has designed, already we know that it is a skill-based university. So that is the key difference between the other universities and Centurion University. So Centurion University, being a skill-based university, we try to imbibe exclusive skill in the students during their academic rather than sitting or rather than making them sit and read theory. Theory is very important, but still giving a skill or giving knowledge on hands-on gives more experience, gives more understanding, and gives more expertise for the student. So that is the reason, that is a unique feature that Centurion University provides by the vast lab equipments that we have. Ventilators, we also give workshops, we conduct conferences, we have expert talks by other medicos from different places, we have national conferences, we have international conferences. So in the learning period itself, we try to create such an awareness for the student wherein which that itself gives a positivity for the student.
So, ma'am, what career opportunities are available after completion of this program?
To be really clear, recently medical care is the key thing for everything. So no matter whatever it is, everybody needs to take care of our health. So any profession or any person into medical care, we have vast and huge opportunities in healthcare profession. So coming to this OT and AT technology, once you just finish your bachelor's or once you just finish your master's or whatever it is, you will be recruited in n number of hospitals. You are selected as an anesthetist or anesthetic technician or an OT technician exclusively in intensive care units, in wards, in trauma centers. And you also can pursue your master's and you can just go into your academics. You can do your PhD. And that is the thing, you don't have an end for this. It's a continuous process of learning. So the career opportunities are wide. Everywhere you have hospitals. Everywhere there is need for healthcare. Without a healthcare profession or without this, we can't lead our life. So literally, you have huge opportunities for people who are into healthcare, exclusively this anesthesia and OT technology. Because without an OT or without a theatre, there is no hospital. So you need people there.
Yes, ma'am. Why students should choose this program in our universities?
As I stated, to be clear, we offer exclusive hands-on, we offer exclusive simulation-based technology trainings, and we also give learning based on practice. As we know that practice makes man perfect. So the more you practice, the more you learn.
Yeah.
So that is, I always state the same to my students. The excess you deal, the excess you go on practicing a thing, you learn perfection. Though you have some problems in the initial time you study because it's hard. It's very hard and it takes a lot of, you have to own it inside. Because every day is a task for us. Every second is a task for us because we deal with human beings. We don't deal with something which is not living. So you have to have that patience. You have to have that sense of courtesy. You should have that sense of approach. Once you take that to heart, obviously every patient or every human being or every person you come in to interact with you enjoy your profession, and in return, the person itself who you are with, obviously he'll be out of whatever the problem he's having.
Yes. Thank you, ma'am. Thank you so much for this insights. And anesthesia and OT technology truly are the form of the core surgical care. And thank you for inspiring students like us and for the meaningful career like this. Thank you, ma'am.
Thank you so much. So once again, I just like to brief it. So this anesthesia and OT technology, whatever the thing, or this is a key thing which has been designed and we are implementing it since many years. And students who have opted for this anesthesia and OT technology, wherein which it is a 4 years course where the students are exclusively trained about basics. They're also trained about the theatre procedures. They're trained about excess of knowledge in critical care units. And the job opportunities of the students is much wider. Being Centurion as a skill-based university, we give more hands-on session and simulation-based labs. And we have huge infrastructure with vast number of equipments. And we have well-trained faculty and professionals of medical care who train our students in building up their career. Thank you. And this gives me a lot of pleasure because I hope so many of the students will explore this course or this career which builds up life in future. Thank you.
It's a pleasure to have you, ma'am. And to our listeners, stay tuned for such academic insights. And this is Centurion University podcast series signing off.